Hello and welcome to the video of the vasculature of the head and neck. I'm Tanya Chamberlain from the Division of Anatomy here at the University of Leeds, and in this video we will be looking at the arteries, veins and lymphatics of the head and neck and some considerations we will need to have during the administration of dental local anesthetics. So let's have a look at the learning objectives we will cover in this video. Use these as a checklist for your learning alongside the workbook provided to ensure your engagement with the material. We are going to look at the arteries supplying the head and neck with reference to three main branches and their subsidies: the maxillary, facial and lingual arteries. We will also look at the corresponding veins. Then we will move on to some considerations and risks of administration of dental local anesthetic, and finally the lymphatics of the face and neck. So let's crack on and look at the arteries of the neck. This image represents a sketch of the anterior neck. Firstly, we need to remind ourselves of some of the existing anatomy we have looked at throughout our first year of dentistry. This is the trachea, or windpipe as it's more commonly known. It bifurcates at the level of the sternal angle into two bronchi, left and right. Here we have the beginnings of the respiratory tract, the larynx. This is our voice box, and in a later video we will look at how this piece of anatomy helps us to phonate, that means talk, but also how this part of anatomy helps protect our airways by preventing the aspiration of food, drink and saliva. On the thyroid cartilage, we can see half of the thyroid gland, which is an incredibly important gland used to secrete hormones for a variety of functions throughout our body. Here we have the hyoid bone, the only bone in our body that doesn't articulate with other bones. This free-floating bone in the neck helps to lift and support the larynx during swallowing to prevent the inhalation of food into our respiratory tract. Now we have covered the anatomical landmarks, let's look at what we have come for: the vessels. The first and very important vessel is the one coming directly from the left ventricle of the heart. This is the aorta. There are three parts making up the thoracic aorta. We have the ascending part, the arch of the aorta, and the descending part. The one we are interested in today is the arch of the aorta. This large vessel carries oxygenated blood from the heart to the body. On the most superior part of the aorta, we have three vessels: the brachiocephalic vessel, which is the artery that happens to be the first branch, and it immediately moves off towards the right-hand side of the body. Then we have the subclavian arteries. The right subclavian comes from the brachiocephalic artery, whilst the left comes directly from the arch of the aorta. These arteries travel down their respective arms to supply the muscles of the arm, forearm and hand. And the root of all the vessels we are going to look at today are these beauties, the common carotids. On the right, this comes from the brachiocephalic artery, whilst the left one arises directly from the arch of the aorta as the second or middle branch. They are called common because in anatomy we like to name things with multiple similar branches as common. So the common carotid artery bifurcates at the level of the laryngeal prominence, or the Adam's apple. The external carotids, which stay outside the cranium and supply most of the face, and internal carotids, which travel up to the cranium and supply the brain and a few other areas. Let's go and have a look at the course of this internal carotid first, as this is the simplest of the two that we need to consider, when looking at the vasculature of the head and face. So this is a lateral sketch, and I appreciate that it looks complicated, but it is my job to show you how to unpick the complicated parts of anatomy and make them simple. You should also note that we will be looking at this picture again in a short while when we consider some anastomoses of the arteries. But more of that in a minute. For the sake of orientation, let's recap some of the vessels that we have looked at today. Here is the common carotid artery. We are looking at it from the left-hand side of the face, so this one has come directly from the arch of the aorta. But I could mirror this image and the rest of the vessels would look the same. So from this point onwards, it's important to know that all of the vessels are paired. That means we have one on each side of the face and neck. The only exception to this is the brachiocephalic artery, which we will not be discussing any further. The internal carotid is the internal branch, so it is deeper than the external carotid. And the internal carotid is travelling up within the cranium, or the brain box of the head. It terminates as the middle cerebral artery, as it changes its name and direction to supply the brain tissue. We will revisit this artery during anxiety and pain management as we look at the blood supply of the brain. As it courses to the brain, it gives off other branches. This one here is the anterior cerebral artery, which is also supplying brain tissue. And we have the ophthalmic artery, which is going to supply the eye before it comes from behind the eye and supplies the forehead region of the head. That's not quite the full story of the internal carotid, but it will do for now. So let's look at the learning objectives before diving into the next stop of our journey. We've had a brief look at the internal carotid, so let's have a look at the more complicated arteries of the face. You'll appreciate that the arteries of the face are very important in dentistry, so we will go into much more detail for these arteries. As promised, it's more complicated, but that doesn't mean we can't unpick what we see. This is the external carotid that comes from the common carotid down here. You'll notice that we have switched sides of the head again. So down here now, you'll see the brachiocephalic trunk. The first branch that we are going to look at is this one, which is the lingual artery. If it is the lingual, it must have something to do with the tongue, and that's exactly what it does. The lingual artery travels with the hypoglossal nerve to the tongue. The artery supplies the tongue, the sublingual gland, the gingiva and the oral mucosa of the floor of the mouth, whilst the lingual vein, as seen on this image, drains the blood from the same region. The artery and the veins have a superficial and deep branch, and if you remember back to our first video on the introduction to the oral cavity, you'll remember that we can see the deep lingual vein on the underside or ventral aspect of our tongue. The next artery is more complex, so let's go back. And now we can see what comes after the lingual artery. This is the facial artery that runs from the external carotid and travels under the inferior margin of the mandible, where you can feel its pulse, before it runs obliquely across the face, giving off branches along the way. It gives off an inferior labial branch that runs deep to the bottom lip, and a corresponding superior labial branch that travels under the top lip. The facial artery then continues underneath the orbit and terminates as the angular artery on the side of our nose. The next artery of interest is the maxillary artery, which can be seen here. This artery is probably the most significant in dentistry, as this is the artery that supplies the muscles of mastication and also the teeth. There are a lot of branches with this one, so bear with me and trust the process. This one, although of less significance, is the middle meningeal artery. When we looked at the skull, we saw the pterion, the suture between the temporal, parietal, frontal and sphenoid bones, and I described this area as being very thin and vulnerable to fractures. You'll also remember that we have an artery that runs immediately deep to this suture. This is the middle cerebral artery, and damaging of this vessel can lead to catastrophic brain bleeds. We will revisit this artery when we look at the anastomoses of the vessels. Here is the inferior alveolar artery. This is the next branch to come inferiorly from the maxillary artery. This artery travels with the inferior alveolar nerve and vein through the mandibular foramen to the teeth of the mandible, where it supplies the blood via dentine branches to each of the teeth on our lower jaw. We also have the pterygoid artery. This is coming from the maxillary artery and goes to supply the medial and lateral pterygoid muscles, the ones that allow us the side-to-side movement of the jaw, enabling us to chew like our trusted friend Clover. And we have the masseteric artery that goes to supply the masseter, which is the muscle that elevates and slightly protrudes the mandible around the temporomandibular joint. We have these small temporal arteries here. These travel superiorly to supply the temporalis muscle, the large fan-shaped muscle on the side of our head that we can feel between our ears and our eyes when we clamp our mouths tight. We have the buccal artery here, which is going to supply the buccinator muscle, one of the muscles of facial expression and the muscle that helps us to push our food from our vestibule onto our teeth for chewing. Remember though, although used during chewing of food, this is not a muscle of mastication. The order of the next two arteries is up for debate, and there is considerable biological variation in the origin of the final artery. The inferior orbital artery passes from the orbit to the exterior, anterior portion of the face. And although not seen on this image, this gives rise to the superior anterior alveolar branch, which travels down here and supplies the incisors of our maxillary teeth. Because we have a superior anterior alveolar branch, we must also have a posterior branch, which is shown here. Which goes on to supply the molar and premolar teeth of the maxilla. The termination of the maxillary artery is the descending palatine arteries, which would travel down here. These transcend into the roof of the mouth and divide into the greater palatine arteries. So let's go and have a look at some eventual anastomoses of the external and internal carotids that help to provide collateral circulation. An anastomosis is simply a joining of two vessels from different origins, and there are a lot of them in the head and throughout the body, but we're only going to concentrate on a few of them this time. So let's call them a taster of things to come as you progress throughout your program. This is how we left the image of the internal carotid course. We have the common carotid, the internal carotid, the ophthalmic, the middle cerebral, and the anterior cerebral arteries. Here is the external that gives rise to the maxillary artery. The main anastomosis is with this red middle meningeal artery which passes behind the pterion. It anastomoses with the anterior cerebral artery. The facial artery from the external carotid eventually anastomoses with branches from the ophthalmic artery as they leave the orbit on the side of the nose. It is important to know that anastomoses of vessels give us a backup plan if one vessel is blocked. An alternative blood supply can be created. But it is also important to know that damage to a vessel will have a knock-on effect on numerous other vessels, which is why we still have to be careful. So let's recap our learning objectives now that we've reached the end of the arteries we are currently interested in. So at the end of the arteries, the next thing to tackle is that of the veins, which thankfully aren't all that complicated. So because of the nature of veins, they drain at the most distal region and travel to a bigger region, collecting more and more blood and therefore getting larger and larger as they accumulate. The first ones to look at are the superior alveolar veins, which we know come as a posterior and anterior variety and drain the molars and incisors respectively. We also have an inferior alveolar vein, which travels within the mandible, draining the blood from the mandibular teeth. These pass up towards the maxillary vein via a plexus of veins sat near the pterygoids, so these are collectively called the pterygoid plexus. These directly communicate with the cavernous sinus, a huge vein-like structure within the skull. More detail will be looked into the cavernous sinus during anxiety and pain management, but for now it suffices to know that this pterygoid venous plexus directly communicates with it, and therefore there is a potential for spread of infection from the pterygoid venous plexus directly into the cranial cavity and the nerves found within the cavernous sinus. The maxillary vein drains into the retromandibular vein, which combines with the facial vein to form a common facial vein and drains into the internal jugular vein, whilst the anterior portion of the retromandibular vein drains into the external jugular vein. Now we've looked at the veins, let's go back and have a quick look at the learning objectives, which is where we are going to describe the consequences of injuring the vasculature of the face during the administration of dental and local anesthetics. So why are veins so important aside from the obvious? Well, in dentistry you'll be administering anesthetics via injection, and this picture shows why the pterygoid venous plexus is important in dental practice. As we'll see in anxiety and pain management after Christmas, the posterior superior alveolar nerve block procedure requires anesthetic solution to be injected into the maxilla, which is of course where the venous plexus is located. It is possible for the needle to pierce the plexus and introduce infection. As we already know, this can have very serious consequences. Note that also the maxillary artery lies in this area, so it is also possible to accidentally pierce this vessel. This is likely to cause bleeding and subsequent swelling on the affected side of the face. Not to mention, you could also inject anesthetic solution into the bloodstream, which can cause systemic toxicity. So let's go and recap where we are in this video. We have looked at the veins, arteries, and the complications of dental anesthetics. So now let's go and look at the lymphatics of the head and neck. As blood is forced under pressure through capillaries, fluid leaks out through thin vessel walls and into the surrounding tissue. Although this is a key means of delivering dissolved nutrients into tissues, it creates a problem. How can we remove tissue fluid and return it to the bloodstream? The lymphatic vessels serve this purpose. They are a network of vessels found throughout most tissues, the brain being the most notable exception to this rule. They travel through the body, coming together to form progressively larger channels, before finally depositing the tissue fluid they've collected, which is called lymph, back into the veins at the base of the neck. The lymphatic system also plays a central role in immune surveillance and response. Studded along the lengths of the lymphatic vessels are sacs of immune cells. These sacs are called lymph nodes. As the lymph filters through the nodes, any foreign antigens are likely to be detected by the immune cells within them, triggering an immune response in many cases. Although the lymphatic vessels that connect them are quite often fine and difficult to see clearly, lymph nodes are much easier to make out, typically being a few millimeters in diameter at the least. Nodes tend to be found somewhere in a predictable arrangement. For example, there are small clusters of lymph nodes around the base of the head, tucked under the chin, under the mandible, just in front of the ear, near the mastoid process, near the back of the head where it joins the neck. This forms a ring of nodes in the superficial tissues around the head. They are similarly superficial nodes with the external jugular vein just under the skin of the neck, below the ear. We have now reached the end of this video, so let's summarise the things that we have looked at. We have looked at the major arteries supplying the head and neck, and we've been able to describe the artery supply to the face with reference to the maxillary, facial, and the lingual arteries and their main branches. We've also had a look at the veins draining the face and the implications of damaging the vasculature of the face during the administration of dental local anesthetics. And finally, we've briefly looked at the lymphatic system of the head and the neck.